A transient ischemic attack, what doctors call a TIA or mini stroke, does not announce itself with a dramatic collapse. It does not come with chest pain or a loud warning alarm. It comes quietly. A few seconds of blurry vision, a moment where words suddenly will not come out right, a brief wave of dizziness that passes before you can even reach for your phone, and then it is gone. And most people never call anyone. Here is what nobody tells you. That quiet episode that lasted 60 seconds and then disappeared completely, that was your brain telling you that a major stroke may be coming. According to the American Stroke Association, nearly 15% of people who experience a mini stroke will have a full stroke within 3 months. And the danger is highest in the first 48 hours after that quiet episode you almost ignored. If you are over 60 and have ever experienced a sudden symptom that came and went without explanation, this video may be one of the most important things you watch this year. Welcome to the Stronger Seniors podcast. I am Dr. Daniel Brooks, and joining me today is Dr. William Carter, a physician who has spent 33 years helping older adults understand exactly what their bodies are trying to communicate. Dr. Carter, thank you for being here today.
Thank you, Daniel. This is a topic I feel very strongly about, because in 33 years of practice, I have seen too many families wish they had known these 7 signs just a little sooner.
And that is exactly why we are here today. We are going to cover 7 warning signs of a mini stroke that seniors most commonly overlook. And we are going to spend extra time on sign number 3, because that is the one doctors say patients dismiss most often and most dangerously. Dr. Carter, before we get into the signs, let us help our viewers understand something important. What exactly happens inside the brain during a mini stroke? And why is it so dangerous even when the symptoms disappear on their own?
Daniel, most people think a mini stroke is like a fire drill, a warning that gives you time to prepare. But that is not what it is at all. A TIA is evidence that a small clot already traveled through your brain, temporarily cut off blood flow, and dissolved on its own. The brain survived. This time. But the source of that clot, whether it is a diseased artery or an irregular heartbeat, is still there, still active. And according to the American Stroke Association, the risk of a full stroke is highest in the 48 hours immediately following a TIA. Not next month, not next week, the next 2 days.
So, when the symptom disappears, many seniors feel relieved and do nothing. Why is that the most dangerous decision they can make?
Because the resolution of the symptom does not resolve the emergency. I always tell my patients the fire went out on its own this time. That does not mean you should ignore the smoke detector. A 2022 report from Mayo Clinic estimated that nearly 240,000 Americans experience a TIA every year, and the real number is likely double that because so many episodes go unreported. People feel fine again and assume they are fine. They are not.
Dr. Carter, you mentioned this is especially dangerous for women over 60, and I have to say, what you told me before we started recording genuinely surprised me. What is it that most people, including many doctors, get wrong about how mini strokes appear differently in older women?
This is where it gets critically important. Most people, and honestly even some emergency triage staff, are trained to look for the classic fast signs: face drooping, arm weakness, speech difficulty. But research from UPMC clinical TIA programs found that women are significantly more likely to experience what we call non-focal symptoms. Things like sudden confusion, general weakness, or a strange feeling of mental fog. None of those fit neatly into the FAST acronym, so they get dismissed as fatigue, as stress, as just getting older. And meanwhile, the clock is ticking.
Sign number 7 involves the eyes, and I understand most people completely misread what they are seeing. What exactly happens, and why do so many seniors brush it off as nothing serious?
Sign 7 is sudden vision loss in one eye only. Patients describe it as a dark curtain dropping down over one eye for about 30 to 60 seconds, then lifting completely. That specific pattern has a name: amaurosis, fugax, and it means a tiny clot has temporarily blocked blood flow to the retina. The eye itself is perfectly fine. The problem is in the artery supplying it. Here is a simple self-test anyone can do right now. Cover one eye, then the other. If that vision change only happened in one specific eye, that is a same-day emergency, not an appointment for next Thursday.
And sign number 6 involves speech. But you mentioned there is a version of this sign that even family members in the same room completely miss. What is that?
Most people expect slurred speech, like someone who has had too much to drink at the holiday party, but sometimes the sign is far subtler. The person is speaking normally, then suddenly pauses mid-sentence, searches for a word they use every day, and cannot find it. 10 seconds later, they are fine. Family members laugh it off. But that brief word-finding failure, appearing suddenly in someone who was speaking normally moments before, is a neurological event until proven otherwise. According to the American Stroke Association, speech difficulty is one of the primary TIA symptoms requiring immediate emergency contact.
Sign 5 is weakness on one side of the body. But you told me before we started that there is one version of this sign that sends people to the wrong doctor entirely. Which version is that?
Sign 5 is sudden weakness or paralysis in the face, arm, or leg on one side of the body. That is the classic fast presentation most people recognize. But here is the version that gets missed. Sometimes it is not dramatic paralysis. It is a sudden, brief heaviness. The coffee cup feels unexpectedly heavy in one hand. The leg feels slightly unreliable for about 90 seconds while walking to the kitchen. Then it passes. People attribute it to a bad night's sleep or low blood sugar. They go see their orthopedic doctor, not their neurologist. That is a critical mistake.
And sign 4 is numbness, which you said is the single most commonly dismissed TIA sign in older adults. I want to hear the story you shared with me about a patient named Gerald, because I think it will hit home for a lot of our viewers.
Gerald was a 74-year-old retired teacher from Nashville, Tennessee. Sharp man, very health conscious. One morning he woke up and noticed his left hand felt strange. Not painful, just numb, the way your foot feels after sitting on it too long. He assumed he had slept on it awkwardly. He made his coffee, read his newspaper, and by mid-morning the feeling had completely returned. He never called his doctor. 3 weeks later, Gerald had a major stroke that left him with permanent weakness on his left side. When we reviewed his history, that morning numbness was the warning his body had sent him. Here is what nobody tells you about numbness after 60. Numbness from sleeping position fades gradually over a few minutes as you move around. TIA numbness appears suddenly without any positional cause and resolves completely on its own. That distinction can save your life.
Dr. Carter, this is the moment our viewers have been waiting for since the title. Sign number 3. You called it the most dangerous overlooked sign. What is it, and why does it fool even careful, health-conscious seniors?
Sign 3 is sudden double vision, or sudden loss of vision, in both eyes simultaneously. And I want to be very clear about why this is different from sign 7. Sign 7 was one eye only, caused by a clot in the artery feeding that eye. Sign 3 involves both eyes at once, which means the problem is further back, deep in the posterior circulation of the brain, affecting the visual cortex itself. This is a vertebrobasilar TIA, and it is far more dangerous. A 2021 study published in the Stroke Journal of the American Heart Association found that TIA events involving the posterior circulation carry a significantly higher short-term stroke risk than anterior circulation events. Now, why does everyone ignore it? Because double vision feels like eye strain. It feels like you need a stronger glasses prescription. People squint, blink a few times, and when it resolves in 90 seconds, they assume it was just fatigue. They are describing a cerebrovascular emergency as an optometry problem.
So, someone could be sitting at the dinner table, notice the candles look doubled for a minute, and think nothing of it. Meanwhile, something very serious just happened in their brain?
Exactly. And I will add something that I think every woman watching right now needs to hear. The UPMC clinical TIA research specifically found that older women are more likely to experience these non-focal symptoms, including visual changes, general confusion, and fatigue, rather than the dramatic arm weakness or facial drooping that emergency rooms are trained to prioritize. This means a woman describing brief double vision at dinner is statistically less likely to receive an immediate TIA workup than a man describing arm weakness. Knowing that disparity exists is itself protective. If you experience it, name it clearly when you call for help. Say the words, "I may be having a TIA."
Sign 2 is balance failure. But you said there is one specific pattern of falling after 60 that families almost always explain away as a simple accident. What should they be looking for instead?
Sign 2 is sudden loss of balance, coordination, or the ability to walk normally. The version that gets missed most often is what we call a drop attack. The person goes from standing to the floor without losing consciousness, without tripping over anything, without any dizziness they can describe. They just go down. Families say they tripped. The person says their legs just gave out. But a 2020 report from Harvard Medical School and Massachusetts General Hospital found that drop attacks in older adults are attributed to mechanical causes in over 60% of cases when no neurological evaluation is performed. The distinguishing question is simple. Did the balance failure appear without any head movement, without any change in position? And was it accompanied even briefly by any other symptom on this list? A momentary blur? A single slurred word? A flash of numbness? If yes, that is a posterior circulation TIA, until proven otherwise. Not a trip, not weak legs.
And now, Dr. Carter, we have reached the sign you said you always save for last, because it is the one that when people finally hear it described correctly, they realize they have been underestimating it their entire lives. What is sign number 1?
Sign 1 is what neurologists call a thunderclap headache. A sudden, severe headache that reaches its absolute peak intensity within 60 seconds of onset. Patients describe it as an explosion inside the head, as the worst headache of their life, as something that has no prior equivalent in their entire headache history. Here is what nobody tells you, and what I want every single viewer to remember. A thunderclap headache may signal bleeding around the brain, a subarachnoid hemorrhage, which requires emergency imaging immediately. And when that headache appears together with any other sign on today's list, any visual change, any numbness, any speech difficulty, you call 911. You do not take aspirin and lie down. You do not drive yourself to urgent care. 911. Because according to the PMCC TIA study, prompt treatment after a TIA reduces subsequent stroke risk by up to 80%. That 80% is available to you right now. It disappears if you wait.
Dr. Carter, we have covered all 7 signs today. Before we close, what is the single most important thing you want every senior watching right now to walk away remembering?
Remember this. The FAST acronym that most people know, face, arms, speech, time, only covers 3 of the 7 signs we discussed today. Signs 7, 3, 2, and 1 fall completely outside of FAST, which means relying on FAST alone leaves you unprotected against 4 of the most dangerous TIA presentations. If any sudden neurological symptom appears and resolves on its own, you call 911 anyway. You tell them the symptom has resolved. You do not use that resolution as a reason to stay home. The 80% stroke risk reduction that treatment provides belongs to every senior who acts immediately. Do not give it away by waiting.
Dr. Carter, 33 years of experience and you still speak about this with the same urgency as day 1? That says everything our viewers need to know about how seriously to take these 7 signs. Thank you for being here today. Now, if this conversation gave you something valuable, I want to ask one simple favor. Hit that like button right now and share this video with someone you love who is over 60. You may not realize it, but sharing this video could be the most important health decision you make for someone in your family this year. And if you want more conversations like this one, subscribe to the Stronger Seniors podcast and hit the bell so you never miss an episode. Before we say goodbye, I want to leave you with something fun, because keeping your mind sharp and active every single day is just as important as knowing these warning signs. So here is your brain health challenge for today. Think carefully, take your time, and drop your answer in the comments below. I would love to see what our community comes up with. Here is the question. The FAST acronym is the most well-known tool for recognizing stroke and TIA symptoms. But as Dr. Carter explained today, 4 of the 7 warning signs we discussed fall completely outside of FAST. Can you name at least 2 of those 4 signs that FAST misses? Leave your answer in the comments, and let us see who has been paying attention today. We are honored to be part of your health journey. This channel is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making health-related decisions. We will see you in the next episode.